exactly 1 in 3 families, according to the National Diaper Bank Network of 2023, families are struggling to be able to afford diapers for their children. Diapers are a basic necessity, and millions of people are struggling to be able to afford these diapers. So I want to take a second and talk about my experience with diapers. I have 2 children. I am a full-time student. I'm a full-time working mom, and I'm also married, so that means I have 2 sources of income. And even with the 2 sources of income, it's been extremely difficult to be able to afford diapers. So today I want to talk about how Congress should pass the End Diaper Need Act to fix health and money gaps in health-related risks, the WIC policy, and legislative solutions to be able to fix this, bridging that gap. So I want to dive in on the silent struggle that 33% of Americans have in their household. Diaper stretching. So not being able to afford these diapers has led parents to diaper stretch. And diaper stretching is a huge problem because it means that they're stretching the length of the life of the diaper, meaning the child is sitting in the diaper longer than they should be. So Regenstrief Institute of 2025 said that 41% of families lack access to diapers, and it leads to them diaper stretching, which also then leads to families having to take their child to urgent care and spending more money into the health industry due to things like they have diaper rashes, so they need the medical attention, or babies can also get UTIs leading from the diaper rashes to UTIs. According to the National Diaper Bank, this has also taken a mental toll, especially on mothers. They've done a study that mothers end up having maternal depression, as well as diaper daycare requirements. So for myself, I know that my son attends preschool at MJC, Miwok. It's a requirement that they have diapers at the facility that is provided by the parents. And they will reach out to you if they don't have diapers for your child, then your child can't attend. And it is like that in many daycare and preschool facilities here today in the US. What this means for work impact for the parents in the workforce, oftentimes if they can't afford those extra diapers that they have to send to the preschool, then that leads to them taking about 5 days, working days off a month because they can't afford to send their child to school. So the harm is clear that financially and medically, if this is so clear, why haven't we fixed this in the system? Federal law for WIC and SNAP is that WIC is used to buy food for mothers and children, and SNAP is for people with lower income to be able to afford food. They can currently buy soda with this money for SNAP, not for WIC, but not diapers. They're not able to buy anything other than food. So many states still tax their diapers like it's jewelry. But in California, they have a SB 92, which fixed the tax on diapers, so there is no tax, but the cost of them is still high. And many parents can reach out to charities in order to help them be able to afford those diapers or get those diapers, but it takes about 1 to 10 diapers, especially for infants, a day, or it takes about 10 diapers a day for infants, and these charities can't afford to give everybody those massive amounts of diapers that they need to be able to keep their child afloat for the day. This solution requires more than local charity, it requires federal law change. The Senate Bill of 2879, which is the End Diaper Need Act. The plan would be that $200 million funding for WIC and social services would change, and that would allow an allotment for these families that need it to be able to have an allotment for diapers to afford to purchase them for their children, so that we are bridging that gap and there is no diaper stretching. This solves issues with the hospital, taxpayer money, and parents working. Because like I had said, when you diaper stretch, it leads to UTIs and extreme diaper rashes, which therefore you have to go to take your child to the emergency room. And if you're on things like Medicare, that's taxpayer dollars paying into that. Parents working, having to take them out of the workforce 5 days a week, and then that also leads to them not being able to afford diapers if they're not working. So it would bridge those gaps. Something an opponent could say to me if we were in a debate, a rebuttal would be that it's entitlement and not an investment, but I'm saying that it is an investment. It's an investment into public health, medical costs that is rising, and being able to help those medical costs by taking away that diaper stretching. So what you can do is there is a website that you can go on, and I also have created a website myself. There is a link provided with a attachment, and all you have to do is just fill out the form and the blanks that have been left. And there is a spot where you can locate a representative in your area to be able to send out this email. We have the power to change for our children, for our community. So to sum things up, no parent should choose between having to give their child a meal or having to give them a diaper. We've reviewed the health risks, the gaps in the policies, and the end need for the Diaper Act. So this is coming full circle ending. How you enter this world by needing someone to take care of you and wearing diapers is also how you leave this world. Typically, you need someone to take care of you, and sometimes you have to wear diapers in the end. And a baby cannot advocate for their dignity, but we can. So let's stop treating hygiene like it's a luxury. Thank you.